station. This is Bobo FM.
The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Do you have a healthcare question but not sure who to ask? Contact HSA's Patient Call Center to speak to one of our experienced clinical team members. We are here to answer your questions and help guide you through your healthcare journey. Need to make an appointment? Our team can help. Contact HSA at 949-8600 or email info@hsa.ky. At HSA, we are committed to caring for you.
All right, welcome to Bobo 103.1 FM. It's Dane hanging out with you. Every single week, we have the opportunity to sit with the great staff members of HSA, and it's various of different departments. I would like to say I think you guys are one of the largest entities here on the island that have employed tons of Caymanian employees. We'll talk about that a different time because I stand to be corrected. But I do know it's a large organization. That much I can say. There's tons of employees. And I learned that because at times when I go to drop my daughter off to work, I am completely shocked by your parking space back behind the hospital. Is this, people are trying to figure out where exactly do I park? And that's how I can tell it is extremely, extremely large as an organization. But also there's a lot of amazing things going on in the background. There's a lot of jobs that you don't know about, you may know about, but you don't know how they operate. And that's why programs like this help, right? A lot of people get to ask questions or get the answer to questions they always had on the top of their mind. Or maybe it's a familiar topic because something currently in your life is happening right now around this topic. So you get a little bit more insight. I can't tell you the amount of people I meet on a daily basis have said, I needed that conversation. There were some questions I had, couldn't reach the hospital at the time, or I was scared to ask that question. You know, in some ways, I kind of felt like I would be looked upon as dumb if I asked that question. But I'm glad that you asked it on the radio. And I can't give myself all the props to the wonderful staff members at HSA that comes up with the questions, in particular the marketing team. But also these guys sometimes give the information to the marketing team of what may need to be asked and what the public may need to know. Now, I have a returning guest to the show. I'm going to have him introduce himself, his title, and just how long he's been with the organization. He will not be a stranger to a lot of people that's listening right now because, like I said, he's been on before, or you may know him or see him around the hospital before. Go ahead.
Sure. Good morning, Dane, and listening viewers or audience members. I am Michael Henry Parchment, and I work at the Health Services Authority Pathology Laboratory.
Big job. How long have you been there again?
Oh my gosh, it's been probably more than 10 years.
More than 10 years.
More than 10, less than 20.
How did you get into this? I always ask this question. How did you get into this field?
Oh man, that's a tricky one.
Yeah.
To be honest, the name sounded pretty cool. I am a medical laboratory scientist.
Yeah.
And at the time, you know, I was pretty focused on the sciences, and I also love technology. So, you know, I got caught. You put the two together, it sounds pretty cool, and I got drafted into a profession that I didn't really know a lot about initially.
Yeah.
Until I started studying for it.
Is that a very intriguing thing around dinner table too, by the way, when you go away and you meet people for the first time, they always ask that question.
It's pretty common.
Yeah.
A standard opener.
Do they want to know more or did they get it right away?
Usually they want to know more because the descriptions I gave it is still pretty vague.
Yeah.
Medical technology or medical laboratory science, well, obviously you work in a laboratory, so you're doing a lot of testing and analysis. And in the hospital setting, what that really entails is dealing with tests for patients, patient specimens, and all of this is in an effort to aid physicians to make diagnosis of their patients.
Yeah.
That's the ultimate goal.
Yeah. And Michael, last time we spoke, you said that this is one of the few jobs that mistakes got to be minimum.
Oh, yes. I'm pretty sure I recall talking about that. I think the last time I was here, I was probably speaking exclusively about the blood bank.
Yeah.
And blood bank, yes, notorious. It's an area where there can be no mistakes. Mistakes can prove fatal. So just speaks to the kind of staff and people that you have working there. They have to be diligent. You have to have skills such as attention to detail and things like that. The ability to work under pressure and just do the right thing consistently all the time. But it is very rewarding.
And patience too, right?
Oh,
you
of course.
got to be a patient person for sure.
For sure.
Michael, well, thank you so much for joining us again. It's always a pleasure to have you here, and we're definitely looking forward to asking some of these questions. And I think one of the key reasons that you are here, one of the biggest objectives, is because obviously this is going to be Medical Laboratory Professionals Week, right?
Yes, it is.
Yeah,
yes,
talk more about that. For those that don't know, what is Medical Laboratory Professional Week?
All right, so Medical Professional or Laboratory Week, this is celebrated, I think, around the world. And during this week, we really just want to highlight our medical professionals, especially people that work in my field, in medical laboratory science, medical technology, phlebotomists, any lab staff really. And it's really just a time to acknowledge them, acknowledge their hard work, and just give them a little time to, we just really want to celebrate them and give them some time to unwind as much as they can while they're still hard at work. That's really what it's all about. You have to recall that medical technologists, they work pretty much behind the scenes. So it's not a profession that's, out front in the public's eye, like, oh yeah, we know exactly what they're doing. We're often spoken about, we work in the background. As I said before, we're doing tests. You often hear a physician or somebody say, hey, send that to the lab. So we are the lab. And again, this is just our week to celebrate our hardworking staff because it's a job that's in the background. It's not often celebrated. The individuals that work there are a mixed variety.
Yeah.
Traditionally, they're not very people-oriented.
Yeah.
They are the kinds of people that are more, let's say, more introverted. They want to just do their work and be left alone. And that's kind of how it originally started. So really this week is about, it's to kind of shine the spotlight on them and let them know that, hey, you guys are so important, the work that you do, and we just want to appreciate you and just send you some love in a manner of speaking.
Would you say, and I know you can't speak on behalf of every single lab professional, but would you say that, lab professionals are people, like when you get around people, it drains you? Does it drain them? Because I was listening to a friend of mine recently that says, it's not like I don't like people, I do like people, but when I get around people, because I'm so much of an introvert, I'm drained. So I'm going to have to find some time to de-stress to get away from that.
Not a problem.
Yeah.
I won't say it's totally true across the board. Of course, you have to make it's nuanced. And nowadays, I think that, that typology is changing.
Mm-hmm.
You got a lot more different types of personalities in the lab now. Thank God for it. I myself, though, I am very much like that. So I can relate to your friend. I love people very much.
Yeah.
I love to interact with them, but the truth is I am just that kind of person. I am an introvert. So it does take its toll on your energy reserves after a while, and there's nothing for me personally better than to just kind of get away into a quiet space where I can read a book, read some articles, or listen to some music.
Yeah.
That really is what I do, kind of in solitude to kind of recharge my batteries. So I do understand your friend, and it's true. It's a mixed bag. But today, realistically, you have many different types of people, thankfully. So it's not, you won't go to the laboratory should you end up there and then see a bunch of people that are like, oh, I don't really talk to people, a bunch of social misfits, as it were.
Yeah.
But it's a pretty big team and lots of different personalities to keep us entertained and keep the work going well.
Yeah. I like to dig deeper and find out more about the characters that work behind the scenes that, like what you said, they often go unnoticed because of the jobs that they do. They're behind the scene. Like you see a doctor, you see a nurse, you'll even see the staff that helps you with, obviously, what is it called again? I think there's some new staff members that you guys have there that help with the experience of HSA. Right. So you see those guys and you see them walking out. Sometimes you even see the board members. Mm-hmm. But do you see the lab technicians? Perhaps
never,
not.
Ever, usually. I think in terms of visibility, since we're talking about that, I would highlight our phlebotomists.
Yeah.
Our phlebotomists, our phlebotomy technicians, they are what's referred to as the face of the laboratory, classically, because they're the ones that patients interact with the most. And so typically when we're recruiting phlebotomists, some of the things that you want to make sure is that, make sure that they're people persons. They know how to talk to people. They know how to calm them down. And so they are our face. And we are, I'll take this opportunity, of course, to let them know how appreciated they are, because that's not an easy task.
Yeah.
Not everyone can be a people person or deal with people when they're not at their best.
Yeah.
So it just highlights the importance of the role that they play in terms of interacting with our patients, our other clients, and also in terms of collecting samples. If they do their job well, then our job goes well.
Absolutely.
So
Absolutely.
just a big chain of hardworking people. They're the front of it, I would say.
I love that. Well said. Now, I want for someone who has never thought about it, how often do lab results actually impact care?
Ooh, well, do I have the statistics? I think someone gave me the statistics, but I don't. I probably misplaced those. But I can easily say, and I'm pretty sure anyone that has been to the hospital and done any kind of work or test can probably attest to this fact that the majority of decisions, especially in modern day medicine, everything hangs on the laboratory. Everything hangs. Whether you go to a radiology laboratory, the molecular laboratory, the work that we do directly impacts our patients. And this is why it's so important for our work to be, quality is a big part of our work, I'd say. And there's no deviation from that because of the nature of the work that we do. If we issue a wrong result, if something is incorrect, if we make a mistake, it can potentially impact patients' care. And that is something that we don't want. I mean, the truth be told, I think the famous phrase is to err is human.
Yeah.
We do make mistakes, but because of the nature of the work, we have to keep that at an absolute minimum. So I'm not here to say that our work is completely perfect, but that is the goal, to strive. We put things in place and we try our very best to ensure that we keep our mistakes to an absolute minimum.
Yeah.
Because of how impactful it is for patients.
Yeah, it is. And we rely on that. That's very important. So we respect the fact that you said you try to keep those mistakes at the minimum, but also it must be a lot of pressure on you guys too.
Oh, absolutely.
Yeah.
Can I talk about pressure?
Please.
Laboratory professionals are very well acquainted with pressure.
I can imagine.
You're dealing with short timelines. You're dealing with severe consequences based on the results that you issue. And in terms of crunch time, a patient comes into accident and emergency. Let's say, for example, trauma. Maybe a bad car accident and the person is broken up really badly. The doctors are doing what they're doing. This person has been bleeding a lot. They need blood. You need to do all of your other battery of testing. Who's doing that? The laboratory is doing that. So one mistake at the crucial moment could be devastating for a patient. But again, thanks to the standard that we work to, it's not a big deal for us. We're used to it.
Yeah.
We just have to deal with the time pressure and, maybe some physicians, when things go wrong, physicians get really nervous.
Yeah.
And they get very impatient. And we have to deal with all of that. And despite whatever else is going on, laboratory professionals have to ensure that we remain calm under pressure so that we can give our best work at all times. And I think that's really where laboratory professionals find. I mean, everyone else in healthcare for sure, but especially due to the nature of our work, we are right up there. So it is a high pressure environment. It's tough. It's not for everybody. It's not an environment where you can come and sit down and it's just easy going all the time. You might get 1 or 2 days like that, but the truth of the matter is that we get lots of samples every day, and we just have to output results for all of our different clients, physicians, patients, whoever, and it's just constant go. So it's like any other business, just that maybe the implications are a little bit heavier, not just for the patients, but also for the staff. I mean, we're dealing with patient specimens. It's not it's not the prettiest job in the world. It's a little bit dirty, a little bit unsafe. We have to be mindful of ourselves. We can be injured on the job as well. Not devastating injuries. We're not in heavy industry where God forbid something could fall on us or we get run over. You know, respect to people that work in those industries as well. That's difficult work. It's very dangerous work. But our work has like biological risks associated with it. We can get cut. We use a lot of sharps. We can get cut. We can get contaminated with, unsavory samples. So we also have to be careful while working in that environment as well. So it's care for our patients, and we also have to be mindful of what we're doing.
Yeah.
We can't be careless either.
Yeah. Well said. And that brings me into a new segue, Michael. Like, how does a day of your life as a medical technology scientist look like? Like, what do you do? Like, how did your day start off today?
Today, I can't use today as an example.
Yeah.
Today's
It's too
been
early,
pretty
right?
great. I was told already that I had to come in, and I was slated to do this interview. And I said, no problem. So it's been pretty easy for me. I came in the morning. I had a nice cup of charcoal latte, so pretty relaxed.
Yeah.
Trying to relax myself to come on here and have this great conversation with you. And I think that's been working well. We've got rain. We had rain earlier, so
Yeah.
I'm in a pretty good mood. But on a typical day, for me especially, I go into work and all the what should I say? Not the questions, but everything just happens, Individuals would come and they say, all the problems come and say, well, we have this problem, this machine is not working.
Mm-hmm.
What do we do? And this kind of thing. And so it's pretty busy from the get-go, but lucky, I think for me, to my credit, I enjoy that.
Yeah.
It's fun trying to fix all those little issues and get us, it's just a regular part of my day. For other staff, they come, they're assigned to their different areas. In the laboratory, we have several different specialties. There's haematology, which deals with, what's going on in the blood. Well, everything, mostly the blood. Chemistry, which deals with your metabolites. Immunohaematology, which is blood banking, which I think many people are familiar by now. And several other areas, microbiology, dealing with a whole other set of testing. So everybody just comes in, they're assigned, and they just get right to it. They get into their work, and that's it, pretty much right until lunchtime. And if the day's not too hectic, we have some conversations in. It's a good environment that we have there, so I'm grateful for that. It wasn't always that way, but thank God for the improvements, So it is, for me, it's a great time. I love nothing better than to provide good service. And this job one thing that this job has provided me is an opportunity to do that in this limited capacity.
Yeah.
Is to make sure that whatever I do is the best that I can do it at, because I know that it's going to have a profound impact on whichever patient, whichever client, whichever physician. So that to me is rewarding in itself.
Yeah.
Not so much the paycheck. The paycheck is okay.
Yeah.
Just in case anyone's wondering.
Yeah.
But the truth of the matter is that in health professions generally, the reward comes from service.
I love that you said that. Yeah.
If you're so inclined, that's the place to be.
It's a good segue, and a great way to end that part of it is service. At the end of the day, you're providing a service to people. And a lot of people, you don't know who you're working on behalf of sometimes. You get their names, I guess.
That
obviously.
is absolutely true.
Yeah.
We see, but that's not important.
Yeah.
And I can even attest to this. It doesn't matter whatever name that shows up. It's the same quality of care that's given.
Absolutely.
And that is one of the great things about that profession. I think there was a time when I think you worry, there's a little bit of nervousness initially when just starting out. But as you mature, as you get seasoned into the profession, as you get much better or you get more experience on the job, it becomes second nature. It's just good service.
It's easy after that.
And I really love that.
Now, you brought up services and your passion for the job and just how much you love to serve people, and obviously what a day looks like, and you explain what the professional week is going to look like for your department. Now, let me ask you, the lab services, is this more than just one type of job that you guys do in here? There's numerous amounts, and can you break them down for us?
All right, let me see how I can do that now. In our pathology laboratory, we have different areas. It's basically the same job. It's all encompassed under the same job. And as a matter of fact, in the hospital as we have it, it's even the responsibility is shared across departments even. So even though they're different departments, we're all doing the similar things. And so we're getting patient samples. For example, if it's X-ray, I'll just put a little segue for X-ray. They're doing imaging studies. That's important because the doctor needs to know what's going on inside visually.
Mm-hmm.
And ours is more hidden. We're not doing necessarily imaging, but we're really looking at what's inside, either the chemical makeup at a molecular level, at a more macroscopic level, dealing with tissues. So we have several different disciplines in the laboratory. But at the end of the day, it's still the same job. Analyzing tissues, analyzing samples, just trying to get information to provide to our clinicians.
Yeah.
So I don't know if you'd like a breakdown of the departments. I can provide that for you.
Absolutely.
If you'd like.
Yeah, if you have it, definitely would
All
love to hear
right,
that.
let's see. So I think I covered some before. So
Yeah,
you have microbiology. So microbiology is dealing with things that you're talking about like infectious substances, infectious single cellular organisms like bacteria. You're dealing with viruses, parasites, fungal infections. These are things that can occasionally, cause problems for individuals. So microbiology, they're looking into that. So they're dealing with cultures. They're looking at what drugs treat or, effectively destroy these organisms. And so that will be passed on to the clinician so that they can prescribe the best medications to treat those patients. We also have histology, cytology. They're looking more at tissue. So you go do a surgery. If the surgeon removes some tissue out of you that doesn't look quite right, or they're investigating, and they will examine it. That will be passed on to the pathologist. They will look and see if they can identify malignant tumors, cancers, things of that nature. Cytology dealing more with that's kind of more like pap smears and those kind of things, or even maybe body fluids that they take out. Again, looking to see if cells are going through malignant changes, cancers, all of that kind of stuff. What else do I have here on my list? Hematology, that's probably my favorite department. I'm actually one of my favorite departments.
Yeah.
And in hematology, you're looking at the physical structure of the blood, like the blood cells. What's going on with your blood cells? Red cells, white cells, platelets, are they functioning well? Are we dealing with clotting disorders? Those kinds of things. Clinical chemistry, which I think many people are also familiar with. You go and you have a test for your glucose, your lipids, profiles, things like that. And then, of course, immunohaematology, blood bank, where we facilitate the blood donation, platelet donation, so that we can provide those products for patients that need. So there's a lot said, but in a nutshell, that's what we do.
Yeah,
in the pathology laboratory.
It's a lot, but it's very important to explain those jobs and what they do. And we're going to actually take a quick, short commercial break. When we do come back, we will kind of break it down again for new listenerships, for those that did not catch it. So we'll go right back over it again. No, Michael has no problem with summarizing it in a very short way, but also in a way that you can understand, because that's what he just did. So we'll break it down, and we'll continue our talks, of course, all around today. We are celebrating, what week is it, Michael? What week is Medical Laboratory Professional Week? It's 19 to 25, right? Yeah, Lab Week.
Yeah, Laboratory Professionals Week. Celebrating our laboratory professionals, the people that work in the background.
That's now.
That is right now.
Yeah.
I think it finishes on Friday, if I'm not mistaken.
Yes.
Monday to Friday.
Today, which would be the day that we are broadcasting this right now. So today's the last day. So make sure you see Michael out, man. You give him some props for the job that he does behind the scenes. We'll be right back after this commercial break. It's Bobo 103.1 FM.
The Health Services Authority has over 120 world-class physicians offering the most comprehensive range of specialist services on island. Our dedicated team of professionals provide the highest quality care in orthopedics, interventional radiology, women's health, geriatrics, and a host of other specialist areas. We are a JCI accredited organization with a proven record of excellence. At HSA, we are committed to caring for you. For more information, visit hsa.ky.
All right, we are back on Bobo 103.1 FM. Dane hanging out with you here. It's a pleasure to do this show on a weekly basis, just to talk to some of the great individuals that work behind the scenes that we don't get to talk to a lot of the times. I have the pleasure of having Michael Henry here from the HSA team. He is a part of course, the medical laboratory area here at HSA. And what would you say your job description before? Just say that one more time, just for our
Oh,
new
the job
listenerships.
description?
Yeah.
Sure. My job is basically to get results from my patients, return to you accurate results in a timely manner, in a nutshell.
And
So I
we
do all manner of testing for patient samples. Anything that doc sends to us, we test. We get the results back to our patients so they can be treated appropriately.
love that. Love that. And there is we are celebrating a week. It actually ends today, but we're celebrating a week of medical laboratory professionals. Sorry. Not here around or here or all around the
It
world.
is worldwide.
Worldwide, right?
So
Correct.
It's a good time for us.
Yes, it is a great time for you guys. We were talking behind the scenes just a couple minutes ago before we came back on the radio, just all the activities that HSA has been planning. And your team, anybody want to shout out for things that's been happening this week? Because it looks like it's been a tremendous week for you guys.
Oh, yeah, for sure. For the pathology laboratory, I got to highlight a young lady there, Whitney Esu. She's the one that has spearheaded all of our activities. And I must say, from what I've observed, the staff there are really enjoying the activities that have been planned. I think even today, maybe ending with some light massages for the staff to kind of help to de-stress them. And I'm pretty sure they will appreciate it. It's not very often that they get to do this, so I think it's a very nice gesture.
Yeah, I love it. I was saying to him that I hope a lot of companies take that initiative on when they are celebrating your employees, even if it's by department, because if you look at different sites now, you see there's a day for every single professional. So maybe you should do something, even if it's on that day, for those professionals to let them feel that they are honored and they are respected. And obviously you see them, you notice them. That's so important. Now, earlier we were breaking down, obviously we talked about your typical day, what it looks like to be a medical technologist. But also, we kind of spoke about the wide range of lab services that are offered. And there was a list of different ones. I want to kind of go back over just some of these. And one of the questions I do want to ask is, let's start with microbiology. What happens there?
Microbiology. Now, in microbiology, we're investigating to see, doc usually suspects that you have some sort of infection, either by bacteria, maybe a viral infection, and they're just doing some study. We do studies in there to try and ascertain if that is really the case. So maybe you have a sore throat. So doc will take a swab. That swab is sent to us for sure. We'll culture it in a special media for the bacteria, whatever's there to grow. And then we'll do our investigations and try and identify if there is a pathogen. And if there is a pathogen, then we'll do some follow-up testing to see what drug is the organism most susceptible to, so he can offer the best treatment.
I love that. Very detailed too. Also, we spoke about this one. I'm going to struggle a little bit with, but how does histology and what is it? The other one, cytology.
Cytology.
Yeah,
Okay.
help to detect serious disease like cancer. This is a big one, especially here on this island.
Oh, for sure.
Yeah.
With those now, you'd go. Those are usually more invasive procedures. For histology, it has to literally do with your body tissues, what's inside. So doc is probably going to cut something off or out of you through surgery. Those tissues are sent to us.
You're asleep for that whole process, right?
In most cases.
Yeah.
You don't have to be for all. Some are not super serious.
Okay.
It all depends on the specifics of it. But either way, we're getting something out of you.
Yeah.
And that will be sent to the grossing lab, where they will look at the tissue usually at a macroscopic level. The pathologist will, take some interesting bits from it, the things that he thinks are interesting and he wants to look at. They will then be prepared by the histotechnicians or histotechnologists, and then the pathologists will look at those under a microscope. So by doing that, they can detect changes in the cells that don't look to be normal, or they can tell if it's normal or if it's moving away from normal. And cytology is pretty much the same, except they're not dealing with usually gross tissue, but they're usually dealing with body fluids or smears. They're similar yet different.
Yeah.
But that's the general crux of it.
Yeah, it's a lot. Like I said, there's a lot of detail, guys, that goes into this job. This one, it's very complex. And not only, well, before I get to that one, let's ask this question here. What does clinical chemistry tells us about a patient?
Clinical chemistry, that one. All right, you probably are familiar with this. Ever go to the hospital and have your blood tested, say maybe did the doctor ask you or tell you that you need to be fasting?
Yeah.
Well, there you go, because he's going to be doing his checks to see your metabolites. So stuff like your glucose, your triglycerides, your cholesterol, because they want to get an idea of, what's going on inside. Like, do you have any issues that could potentially lead to cardiac issues, cardiac problems? Do you have any issues that could lead to other chronic diseases of lifestyle, such as diabetes, things of that nature? Clinical chemistry takes care of all of those metabolites, including drug metabolites.
Yeah.
So pretty important. And the beautiful thing about clinical chemistry is that clinical chemistry and some of the other departments as well, they deal with a lot of automation and very complex machinery. So the techs themselves usually don't have to work tremendously hard, at least not physically hard, but their work is a lot more brain work. They have to monitor results. They have to know what's critical, different alert values. And they also have to do a fair amount of statistics. That gets into a little bit more of the complex side of testing.
Yeah.
Because if you think about it, we're just running a lot of samples on analyzers. And to some people that might come in and see it, they're like, oh, but like, what do those guys do? It's often said, like, you just put things on a machine. You're not really doing anything. Partially true, not really. Because yes, while it's true that the instruments handle a lot of the steps, because if we were to go back to that, then it would take days to finish our testing, which we don't want that. We live in a society where things have to be done quickly, rapidly. Hence the need for instruments and automation to some degree. But the technologist role really is really crucial in understanding results generated from the instruments. The instrument is just spitting out results. It's doing what it's been told to do. But how do you validate that information? That's really where the technologists shine.
Yeah.
That's where the knowledge really comes in. It's a little bit of math, a lot of statistics.
That's what I was about to say, because, I give an example. When I went to do a recent blood test, because I was just feeling out of it. There was just so many different things happening in my body. And I'm glad that I did, because I went to the doctor. The first thing they wanted to do was obviously do a blood test. They did all the checks, like blood pressure and so on. But the stuff that's unseen, obviously, you have to take from your blood to kind of see more. And there's obviously different exams that you can do. But the first thing doctors really want to do is take a look at your blood. And by them doing that, they obviously take this out. Then you're sitting down uncomfortable for the next week, trying to wonder, is your results going to be positive or negative? And you're thinking of so many things. Anything like me, you're thinking about the worst first, right?
That's usually the case.
Yeah, and especially when a doctor calls and says, can you come in? We'd like to see you. Always two words I do not like to hear from my wife when she says, we need to talk. And a doctor saying, can you come in? No, can you tell me over the phone? Can you just say to me over the phone what we need to talk about? Maybe that's something that we could talk about too, Michael.
I'm not sure. Maybe they like the suspense, or there's probably some legal reason why they do that.
Yeah, I think it's a legal reason, but I'm glad that you said that, because that's the next question I was going to ask you. Why do doctors do that? Why do they be like, let's talk about it in the hospital, right? But anyway, I went there and he started to go through. I kind of felt I understand the reason why he wanted to see me in person, because he wanted me to understand.
That's right.
Even if it's good news, he wants me to understand what I'm about to go through, right? So he did say things like, borderline diabetic and just different things that I need to be concerned about. And I'm like, you see all of this from a blood test. How is that possible? And obviously you going through all of this, you would know more of this information, right? Walk us through that a little bit. How are you seeing that I'm pre-diabetic? Like, what is the blood telling you at that point? And do you have the answer? Sorry.
I could shed a little bit of light on it without going into super detail. But really what it is that you have different organizations that study all of these things. They do a tremendous amount of studies. And of course the clinicians are heavily involved in this because they actively see and study disease and things like that.
And what you're saying, and I'm not cutting you here, I just want listeners to hear this from the perspective I'm hoping they're getting it from. Are you saying to me that this goes beyond the doctors? So there's different individuals that are looking at your
probably
your blood
a little bit beyond like just the doctors that maybe work in the hospital.
Yeah.
This would be still by doctors, but it's in a different setting and more in a research setting.
Yeah.
So they will do these incredible studies, and then they formulate in terms of like they decide kind of like what's normal, and they establish the ranges. And of course, these ranges are up to debate.
Yeah.
Because again, humans are involved, but they try to establish them in such a way, usually, so that to promote screening of the population, which is where you get the term like pre-diabetic. So they want to try and address issues or spot potential problems before they happen. And that's across all the board with different things. So whether it's glucose for diabetes, cardiac studies, there are lots of studies going on. And that's really why we are where we are today, because that information is provided to us, which is how we're able to establish what we think, like this is what normal is.
Yeah.
And if you go above this, then we're treading into maybe not so safe territory. And that's just in a nutshell kind of how things are done. And that's in terms of the establishment of ranges. And as I was mentioning before, to try and tie it in, from the analytical perspective, it's a little different because we are the ones that measure. And if you know anything about measuring, if I were to give you a ruler and say, hey, measure like across this desk, what do you get? And you tell me, oh, so many inches or whatever. And I say, okay, great. Who made the ruler?
Yeah.
So it gets a little bit tricky, but that is usually the process, the scientific process for how all of these things are done. There's a little bit of variations in the measurements.
Yeah.
But the information is looked at very broadly and over long periods of time, and that is how they're able to establish all of these different things. So on the one hand, you have the ones that establish the ranges, and then on our part, we deal with the measuring.
So good.
If that kind of helped. I hope that helps a little bit.
It did, big time. Helped big time. What I do want to ask, I think it was a question I had deep in my mind that I wanted to ask, away from our conversation here. But yes, now I got it. So just recently I was sitting in a board meeting and we were talking about a marketing plan for a documentary that we wanted to put, like we wanted to be shown. My job has become so much easier when I can go into my laptop and I can say, Claude, this is what I'm looking for. I need this. And I have a full-on marketing plan in less than 5 minutes. So I want to know, as AI technology helped you guys and make things a little bit faster, because I said to you a couple minutes ago, I usually got to sit down a week and wait for my blood results. How does AI help you guys?
AI, that's the hottest topic right now.
It is, biggest one.
For laboratory, at least in our setting, I can speak about our setting. I can't really speak outside of it.
Yeah.
But for our setting, we don't really rely on it too heavily. But
that's still
AI,
very much humanized.
Oh, really? Yeah. Really. I think that the potential thing for our laboratory, or the potential quote unquote threat, maybe, would be automation. And that has to do, AI is tied into it, but it's more like the robotics of it. So you basically just engineer the system to remove as many people as you want, if that is what you desire. I don't think I'm not an official economist. I'm not a finance person.
Yeah.
I'm a human being. And so I will speak from it from that point. And I think that I look at it from the perspective that, look, people need work.
Yeah.
And there's an element that only people can provide. And so not to knock the need for automation or thing, in some cases there is a need for it, but I would just say you have to be very careful. And again, to answer your original question in terms of what we use it for, in our laboratory, nothing that I'm aware of as far as our instrumentation goes, but I do know of instruments now that incorporate it in terms of reading certain samples, it is pretty interesting. I did not get my hands on any just yet, but I have seen it, and it is pretty interesting to notice because the example that I saw, it was a test that, I'll be honest with you, it's not very fun.
Yeah.
So it is tempting to move in that direction, in certain cases. But that was the only instance of it that I've seen so far. But I'm pretty sure, this is the time for that kind of stuff if you're following the news and tech. And I'm pretty sure we'll see more developments coming mainstream now. I think the thing that saved us so far is that a lot of the instruments are very expensive. They are insanely expensive.
Yeah.
Okay. And I think that is probably the main drawback as to why it hasn't been incorporated heavily. And then again, this technology, as far as AI goes, it's really not, I think, at the place that some people, say it is. So yeah, it will come eventually. It will come eventually.
I mean,
but right now, it's really not there. I don't think.
Yeah, yeah. Well respected too. Short answer: Do you trust it?
Oh man.
Yeah. I mean,
again,
you won't get in trouble with your job for that.
Oh no, not at all. Not at all. These are all theoretical questions.
Exactly.
Do I trust it? It depends on the application. I think it can be trusted, but it all depends on the application. And I think since you brought it up, one of the main problems I think that I see with it, because I'm a techie person, so I love to follow everything that's going on.
Yeah.
Side note. But what I've seen is that a lot of what's there now is really, it's money and investment. And so people will say all sorts of crazy things that it can do, which those applications are currently not realistic or not practical.
Yeah.
But there are things that it can do, and the things that it's able to do, I don't have any problem trusting it.
Yeah.
But don't ask it. For example, you gave the example for it to prepare your marketing your marketing thing. It can do those things, and it can do other things, and I think it does it well. But there have been documented instances that if you scrutinize it, because even documents, I've seen things that are prepared, and I can look at it, and you can kind of detect, like, yeah, I think this was put together by AI.
Yeah.
Because you will notice it. What it really does is just averages things. If you think about it,
yeah.
It's kind of like an average of words and data. If you put it that way, so you can see it. So it's good, but you have to know what you're using it for. It has to have a specific use.
Yeah.
But just the general thing that I think a lot of people are promoting, no. You have to be very careful, and it needs to be scrutinized.
Yeah, please be careful with it. I will say that, because I was bigging it up to putting together a marketing plan. But guys, I still had to do the work. I still had to kind of look through that marketing plan and kind of humanize it a little bit, especially because of our region. But also, I'm looking at it right now, and Claude does say certain things like, please make sure you double check the responses.
Excellent.
It's saying that for a reason. And then the reason I brought that up is because I think it's creating a lot of fear amongst people in the medical field. I know for me, I can only speak for me. I can't speak for anybody else and my family. I think I can speak for my family too. I would hate to know the day will come that I sit in front of a computer and that's my doctor, or, a lab technician is now being replaced by a machine, because I do feel like humans, they take their time with the stuff like this. It's almost like they're riding a donkey with things, and we need that type of outlook when it comes to checking on us, because we don't want any mistakes. Like I said to you before, there's certain things I can think of in life right now that you have to limit the mistakes that you make. One is obviously your job, being a doctor, being a pilot, and obviously police officers, and so on. There's actually a gigantic list if you think about it.
Real world is very nuanced, and I think that's the word that I like.
Yeah.
Things are nuanced, things are complex. So where you have that complexity, I think you want to rely more on people that are qualified to do what they're supposed to do, as opposed to a program to run it. And again, it just goes back to my personal belief on it. If a task is simple and repetitive to a degree, predictable, measured, for sure. It's the same thing over and over, that's fine. But where nuance is involved, I think you got to be very careful. We have blood bank.
Yeah.
I mean, sure, I'm not saying a computer couldn't do it, but do I trust it?
Yeah.
One day it could make a mistake.
Yeah.
So I think there's always, people should always be in the equation, and that's just my personal take on that. Since you brought it up, very interesting topic, by the way. I'm
interested in one because it's your week, right? You're celebrating your week, but also we can't ignore the fact that technology seemed to be taking over where people used to have a long-term job.
Oh, yes.
Yeah, so I brought it up for that because it's a behind-the-scenes job, but there are some people that have the belief that, well, technology can do this. Not for this one. Not for this. This is really a detailed job, and I'm not saying computers are not smart enough to do it, but you got to remember who made the computers in the first place. Yeah. So, I just want to be careful with that. Great conversations that we're having right now. We are celebrating, obviously, for those that are joining us for the first time, we are celebrating a very special week today. And of course, it is Medical Laboratory Professional Week. And we have Michael Henry, right?
That's correct.
That's your last name, right? Michael Henry is joining us from HSA, and he's a part of the lab. He's a scientist there. He's been there for over 10 years. And it's a pleasure to have him here in the studios. When we come back, we'll talk about how do you receive your results? And we'll also talk about, we talked about blood banks before. We talk about that too. And just more with the HSA team and what else, what more is to come. And this will be our final segment, by the way, guys. And when we come back, we're going to be wrapping things up. So if you have any questions, just go ahead and send them in. We'll get them to Michael or the marketing team. And you can send us a message on our Instagram or Facebook at Bobo 103.1 FM. That is our social media handle, by the way. So once again, that's Bobo 103.1 FM.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
Welcome to Bobo 103.1 FM. Dane still hanging with you guys, and this is the wrap-up portion of the show. We usually have, this is a little segment where we ask some last-minute questions that potentially came in, or we leave it open for you guys to ask any questions that you may have. All right, so go ahead and send a message right now to our Instagram or Facebook at Bobo 103.1 FM. We have Michael Henry joining us here. We're celebrating, of course, a big initiative this week, and I don't want to call it a give back, but a recognition for a certain team in the hospital, obviously. And we're talking about the medical lab team, right? We're celebrating them for the week. This is starting from the 19th, Michael. Today is the last day, correct?
Oh, yes. I believe so.
Yes, it is the last day today from what I'm seeing here. And we've been talking about so much wonderful things about, what does a lab technician scientist do? What does the day look like? What are their concentration? How do they find the job? How do they get into it? We've asked so many questions. We're going to continue to replay this show at some point so you guys can hear it again. If you do want a copy, you can also send us in for that too. I'm pretty sure the hospital would love to pass that on. For anybody that likes to listen, we've done it in the past before for people that listen to the show and they say, hey, I would love a copy of that show. I want to listen to it again. So they treat it like a podcast. But I want to ask this question. How does patients receive their results?
Oh, our patients we serve, those are the ones we love. Everything we do is for them. So, again, all of our testing is really for our patients, our clients. And this is, what should I say? We have faced issues in the past. Yeah. I don't know why I feel the need to open with that, because I feel that there might be some people out there that might not be happy. So let me do some damage control first.
Yeah, man.
But ideally, the ordering physician, the physician or the doctor that orders your tests, the results are supposed to be faxed or sent directly back to them. Once the tests are finished being performed, once they're verified, those results are supposed to go immediately back to the ordering physician. Also, the Health Services Authority provides the patient portal, which I believe is an app. Now, I'll honestly tell you I'm not too familiar because I'm not the one that came up with the app, but I know it's available. Like any app, you just install it, you set it up, and you have access to, I believe, the majority of your results. So most people, I believe, have smartphones. So you can get the app, you can sign up for it, whatever you have to do, you have the results on your phone. I will give you the disclaimer that not all results go. There are some results that we deem are sensitive. I believe, Dane, you alluded to a little bit earlier that when the physician called you in. Yeah. Because, nothing can really replace, or I hope for most people, you don't really want to replace that face-to-face relationship with a physician, your primary care provider. This is the person that's dealing with your health, so that they can take their time and discuss with you, what your results mean, answer any questions that you have. But the patient portal is there. It's available for you to see results that we deem, are okay for you to see, and you can just go through them and you can kind of get some understanding. Because we're in modern times, people have access to so much information now. Some may not fully understand how to apply it, but information is out there everywhere. So the portal is there. And of course, all results go to the medical docket for every patient. So at the Health Services Authority or any other health institution, your results go directly to the medical records department. So you can go there, you can request a copy of your results. You should not have any issues.
Love that. Very detailed too. Really quick one before we wrap up the show. Why is the blood bank such a critical part of the health system?
Blood bank. Blood bank is critical because of the nature of the product. If you can just stop and imagine with me, I think I gave the example before, sort of with a trauma case. You're just up on your day here, just going up and about, and unfortunately, oh no, bad car accident. Person is injured, ruptured spleen or something, they're bleeding badly. That person is going to pass away or in danger of death if they don't get that blood replaced very quickly. The blood bank is the place that collects blood from all of our donors. Blood and blood products are derivatives. We do whole blood, we do platelets, and plasma. So it is important to have a bank or storage for all of those products because you don't know what the day holds. Yeah. Anything can happen with one person, any number of people. And the blood bank is that safety net where we have those products we screen them to make sure they're safe, they're compatible, and they can be administered safely and quickly to patients that have that immediate need, because that will ultimately save their life. So super important. So just take this opportunity to encourage all of our donors or people interested in donating, reach out to the blood bank and become a donor. It's so important. And I also will say, I always like to say, I'll include it quickly, that the Cayman Islands, the people of the Cayman Islands, all people here that reside here, have been very supportive of our blood bank, and we really appreciate your support. Please do not stop supporting, whether you're here, wherever you are, always support your local blood bank. Very important.
Very good message, Michael. And with that, we want to kind of give you your locations or how you can donate blood or ask more questions. Book via the bloodbank.ky or call 244-2674. Walk-ins are also accepted, by the way. Opening hours are from Monday to Friday to 7 a.m. to 6:30 p.m. and on Saturday from 9 a.m. to 5 p.m. That was Michael Henry. Thank you so much for stopping by, part of the HSA superhero team in the background. Enjoy your massage today.
I will if I'm to get. I probably have to be busy elsewhere, but
yeah.
But the guys there, it's really for them.
Yeah.
They're important. I love them. They're a great team, and they work very hard. They deserve their flowers. So I have no problem with them getting the treatment. Whether it's our laboratory, I made reference to, I think, radiology, and a special shout out also to the Cayman Islands Molecular Laboratory, which is also at the Health Services Authority. They're doing tremendous work as well, in the same vein as what we offer. It's testing samples that have implications for the patients that they test for. So it's just great to be a part of the team at Health Services Authority. This is what we do, and we do it with pleasure.
Well said, Michael.
To support the public as best we can.
Well said. Thank you so much, and I hope I see you again soon.
Thank you so much. It's been a pleasure.